Over 70,000 Americans aged 15 to 39 are diagnosed with cancer every year. To put that in perspective, it's about 6 times the number of cancers diagnosed in children ages 0 to 14. Cancer in adolescents and young adults also manifests differently than cancers seen in children or older adults, and must be treated as such. Hi, I'm Marie Sad, and this is Come On In, AYA Cancer Unfiltered, a podcast for cancer patients aged 15 to 39. When I first heard the term AYA cancer, I was confused. It's not a term we hear a lot in our day-to-day lives. Like, what does that mean? Is it a type of cancer, a classification? It's overwhelming. When I was a kid, my aunt was diagnosed with familial breast cancer and found out she was a carrier for the gene BRCA1. It's a gene that's closely connected to cancer. Her two sisters, my mom and my other aunt, realized that they could be carriers as well and chose to get tested. My mom was clear, but my aunt was precancerous. Both my aunts, along with one of my cousins, chose to have a mastectomy. It would have been safer for my cousin to additionally have an oophorectomy, but she was young and she wanted to start a family. Fast forward after surgeries, and my aunt is in remission. And my cousin has a beautiful family. But I know it doesn't always end so nicely. And in the last year, I've lost 2 beloved friends and family members to cancer. Their determination to help and inspire others is why I'm here. This podcast was created to bring together information from experts all over the world, to connect you with organizations who can help, and to take you through the entire cancer process, from diagnosis to treatment, then on to healing and well-being. On today's episode, we talk about diagnosis. What is AYA cancer?
AYA is the term for adolescent young adults. The National Cancer Institute of the United States defines 15 to 39-year-old patients as AYA. These patients require their own special approach. When a patient is diagnosed with cancer, it's like their world stops. Time freezes. Life can feel shattered. It is very scary. Everything they thought they were going to do with their life is suddenly on pause.
That's a quote by hematologist and oncologist Dr. Leonard Sender, founder of the Society for Adolescent and Young Adult Oncology.
Will they survive? Will they be a new normal? They feel alone. They don't know who to talk to. They're overwhelmed with information and people speaking a new language to them that they don't necessarily understand. There is tremendous stress.
It's important to know right off the bat that AYA cancer has a high survival rate at 85%. However, most AYA cancer patients still feel scared, confused, and isolated. When an AYA begins their care, they will have a whole team to support them.
My name is Jonny Imerman. I'm a first-gen Asian American Indian. My pronouns are she, her, hers. I currently work as a pediatric social worker in the outpatient surgical specialties at UCSF Benioff Children's Hospital.
Jonny has kindly joined us to talk about what patients go through after cancer diagnosis.
My connections with AYA are kind of twofold. My first one is as a patient. I am a surviving osteogenocarcinoma at 15, and then also an ovarian cancer survivor at the age of 38. And then my second connection to the AYA world was through as a social worker in pediatrics. I was a pediatric oncology social worker, and I'm no longer. But I have about 13 years of experience and was in the AYA world quite a bit.
What is an oncology social worker anyways?
Sure. So pediatric oncology social workers, we are primarily taking care of patients who have all different kinds of cancers in the pediatric world. I feel that we support them throughout all phases of cancer treatment: initial diagnosis, relapse, end of life, survivorship. And from the initial diagnosis, I think we as social workers in the oncology world we psychosocially assess the patient, their family, in order to provide the optimal care of treatment. And I think, that includes all aspects, so age, sexual orientation, family dynamics, cultural identity, and spiritual preference. And the more we get to know the families, the more we can kind of help them manage and cope with their treatment.
So, Jonny, what happens right after you get diagnosed? You know you have cancer, and now what? What's running through your head?
Well, I mean, from personal experience, you hear these words called I've been diagnosed with cancer. Your stomach turns upside down, you're in shock, you feel like, wait a minute, is this me? Like, are you actually telling me this? Your life stops, right? And you have to take a pause. You go into this mode of, okay, so what are my treatments? What are my side effects? How am I going to manage this? I'm in college or I have a job. Um, how do I do all this? Then it's like the big question is, am I going to die? What are my friends going to think? What are my family going to think? Do I tell them? Do I not? There's a lot that goes through your head, you know? Um, so yeah.
What kind of support should newly diagnosed people seek out? Are friends and family going to be understanding? It's challenging for them too, right?
You will find those who can support you, and you're going to find others who just can't because they don't know how to support you. They feel like maybe they're not saying the right thing. They don't know what to say. They want to support you, but then sometimes it it may not be a support. And there's others who just want to dive in and say, okay, what can I do? Let me take care of your kids. Let me bring you food. It just depends on the person, right? I can give you my own personal example where I had the ovarian cancer. I can no longer have kids. So I had a full hysterectomy, and it was really hard because I've always wanted to be a mother. It was really hard for me to think about the fact that I will never be a mom. And I remember my friends bringing their children to me in the hospital. They wanted to support me, and that was a way that they were trying to be helpful, and that, to me, at the time when I couldn't have any more children, it was really hard for me, right? I think families are going to be understanding. I think friends are going to be understanding. I think if they have had a personal experience with cancer, sometimes they're like, I need to take a step back. It's too painful for me to have to relive whatever I relived in their own personal life. Now, I also am coming from an Indian culture. So I think my parents had heard things like, you must have sinned and done something in your life, and God is punishing you through your child. That's why she got cancer. Like, those things don't make sense. It has changed a lot.
And that's why it's so important to find someone who can understand. Most 15 to 39-year-olds don't know anyone their age who've had cancer. And if they do, it's almost never the same type of cancer they're going through. That's why it's important to find an ally. Imerman Angels does just that. And today we have Jonny Imerman, the founder of Imerman Angels, joining us. Hi, Jonny, and welcome to Come On In. Can you introduce yourself and talk about your connection to AYA cancer?
Absolutely. Great to see you. My name is Jonny Imerman, and I am from Detroit originally. And I was a couple years out of Ann Arbor in college and got diagnosed with advanced testicular cancer. Went through chemo, went through surgeries, better part of about 2 years in my 20s. And I ended up quitting my corporate job, had an epiphany, which a lot of people do when you're young and going through cancer. And that kind of a trauma is going to kind of rattle to your core and kind of makes you think about life and what you want out of it and what footprint you want to leave. It really does affect, I think, most young adults who go through cancer. And for me, hung up the suit and tie, a group of young survivors and I met randomly at the hospital. We all quickly became buddies. We had so much in common. And we all said, you know what, we can do something to make this cancer world a better place. And the way we thought we could really make it a better place is being mentors for people diagnosed with the exact same thing because we knew that we didn't have it. And so together we co-founded a nonprofit called Imerman Angels. It's a one-on-one peer mentor program. So anyone, any age, anywhere on the planet going through cancer, they can find us and we can introduce them to somebody who beat the exact same cancer, who's the same age, same gender, walked the same walk, and says, this is how I did it. This is what I learned. This is what you should know. And there's a great life outside of cancer. No one should fight alone.
What's the benefit of peer-to-peer support? Why is peer-to-peer support so important after a cancer diagnosis?
You know, peer-to-peer support, we believe, is so important because a doctor can tell you what they're going to do to you with chemo and they're going to tell you what might happen, but you kind of know that they've never done it before. But when somebody looks into your eyes, whether it's in person, the best, or on Zoom, pretty good too, and they say, I've actually done this before, look at me now, you give people hope.
And can I ask you, what's the right time to seek out peer-to-peer help? When should someone contact Imerman Angels?
Great question. The best time for peer-to-peer support, we believe, is the same day you get diagnosed. Right when you get diagnosed, we love the hospitals, and there are many who will refer people to Imerman Angels that moment and say, hey, I know you're in shock. I know you're scared. I know we just dropped this bomb. You have cancer. But here's your resource. I can meet someone who beat your cancer. We love them to do it that day. I mean, we've had people 20 minutes later after getting diagnosed, they're literally in the parking lot and they pull out their cell phone as we're leaving the hospital and call us and say, hey, my doctor told me about you. I just got colon cancer and what in the world is happening to me? And I'm terrified. And we immediately want to get in there and show them the positive. So that's really the main reason why I think earlier is better, because if they reach out immediately, we can immediately show them that, hey, at least one person has beaten your cancer in the same position. You can do this. And immediately you give them hope.
Peer-to-peer support is incredibly important. However, if you've been recently diagnosed, the person you're going to interact with directly is your oncologist. Here's the thing. Not all oncologists, that is, doctors specializing in cancer care, are the right oncologist. Dr. Sender, who we spoke with earlier, developed a list of questions that all young cancer patients should ask their doctor during the first appointment.
I developed a campaign called Stop a Doc. The goal of this campaign is to empower patients to ask your treating physician 5 very important questions. Your doctor should be able to answer yes to all of these. 1. Do you know that there is an adolescent young adult cancer segment called AYA? 2. Are you aware of the unique physical, psychosocial, and social needs of AYAs? 3. Are you familiar with the clinical trials for AYAs? 4. Can you refer AYA patients to an AYA-specific resource? 5. Do you regularly treat AYA patients, and if so, do you have an academic and clinical experience focused on the 15 to 39-year-old cancer patient?
We'll post the 5 Stop a Doc questions you should ask your doctor below so you can bring them into your next appointment. If your doctor doesn't know the answer to these questions or seems reluctant to answer them, you deserve to find a doctor who can. This is your life, and you want to find a person you're confident can help. The goal is to obtain an accurate diagnosis, then agree on a treatment plan that gives you the best possible prognosis.
Prognosis is defined as the estimate of the likely course and outcome of your cancer. Try to get your doctors to give you statistical data based on specific diagnosis that you have. It is important for you to understand the type of cancer you have and the exact stage. Tell your doctor not to simplify what they're telling you. Ask them for the facts. But remember, they are just statistics and they aren't perfect resources for your own cancer. Use this data to help you make a treatment plan that you feel comfortable with, and we will get you the best results.
Another thing you'll want to consider when talking to your oncologist is oncofertility. Oncofertility is the intersection between oncology and fertility preservation. It's something many oncologists have little training in, but is vitally important. Dr. Lakshmi Kondapalli, an award winning, board certified endocrinologist and reproductive specialist, explains.
Fertility preservation is particularly important for AYA patients because some of the cancer treatments that they may receive may actually impair their ability to have children in the future. My role as an oncofertility specialist is to think, one, about the fertility issues, but also to expand that to consider sort of the whole host of reproductive long-term side effects that may result of their cancer treatment.
That's a very brief introduction to oncofertility, and it's a topic that requires a lot of consideration. We talk in depth about oncofertility in episode 3, Diagnosis, Your Fertility Options Before Treatment. It's very important that you listen to this episode before starting treatment. Once you start treatment, most options for fertility preservation are no longer possible. This is important even if you don't think you want to have children or aren't considering having children at this time. We've talked a lot about how to interact with doctors during this episode, but there are some changes you can start to make right now that can positively affect your health from home. We're talking about nutrition and lifestyle. Jocelyn Harrison, a registered dietitian with a master's in public health and the founder of Pacific Nutrition Partners, is here to shed some light on lifestyle habits during cancer. Hi, Jocelyn, welcome.
Hi there, I am Jocelyn Harrison. I'm super happy to be here today with everyone.
So Jocelyn, can you explain what a registered dietitian is and why they're so important in the AYA cancer world?
So a registered dietitian, and we are also referred to as a registered dietitian nutritionist. Those two terms are completely interchangeable. And the quick way to say it is an RD or an RDN. So RDs have specialized training in using food to promote optimal health and manage and treat diseases and conditions. An RDN is part of the medical team. And one who works with cancer patients is called an oncology nutritionist. And there is actually a board certification for specializing in oncology nutrition for RDs. The reason that working with a registered dietitian is so important in the AYA cancer world is because as someone dealing with a cancer diagnosis, you have very specific and unique needs. And a registered dietitian has the training, and all registered dietitians have a standardized training. And so you know that you are in the hands of a competent professional who'll be able to interact with your healthcare team and actually be a part of your healthcare team.
In addition to being an RDN, you also have an MPH, right? Can you help us understand what that is?
So I have a master's in public health. That really takes a look at what influences a person to eat the way that they do. And it's much more than knowledge about what to eat. It has a lot to do with their culture, where they grew up, their friends around them, the neighborhood that they live in. So I wanted that broader view. So when I'm meeting with somebody one-on-one, I can take all those other factors into account.
When did you become a healthcare professional? What interested you about this line of work?
So about 15 years ago, the chronic disease epidemic hit my family really hard. After losing my mother to cancer and dementia, and my brother to multiple sclerosis and a heart attack, I just looked around and I thought, people are getting sick, and something needs to be done about this. And I want to help. I was really, really motivated. I had a previous professional career. I left that career. I went back to school for 6 years to become a registered dietitian nutritionist. And that's because I'd always made a connection between food and health. And actually in physical activity and health. It's been a passion and a hobby of mine for many, many years. I felt like this was the way that I could make the biggest impact.
After a cancer diagnosis, should you think differently about your diet and exercise?
When you get a cancer diagnosis, you're usually very overwhelmed, but diet and physical activity do play a huge role in your overall health. And so it is something that you need to think about and something that you kind of need to put on your plate, so to speak. And you're going to have different physical needs, dietary needs and physical activity needs throughout the cancer journey, and they're kind of different aspects to each phase of the journey. So when you're in the diagnosis phase, truthfully, what you really are going to be focusing on is getting a very accurate diagnosis and then determining what your treatment plan is going to be. And so your focus might not be on diet and exercise at that time, but there are some things that you can do.
What's the most important diet and exercise advice you have for newly diagnosed cancer patients?
Well, the first thing you want to get expert advice from your healthcare provider, from your doctor and your care team. Find out if there's anything that you should be considering in regards to diet and physical activity. And also ask if they will refer you to a registered dietitian. Get expert advice. Don't go down the Dr. Google rabbit hole. So that's the number one thing, expert advice. The second thing is when it comes to diet, you really want to make sure you're getting in lots of nutrients. And the best foods to have a rich array of nutrients that your body is going to need to stay strong and heal are fruits and vegetables, quite frankly. So, the more fruits and vegetables that you can incorporate into your diet starting very early on in your journey, the better. But don't overwhelm yourself and try to make huge wholesale changes. Be gentle with yourself and just do the best you can considering what you're dealing with. Another like quick and easy thing as far as your diet is concerned is stay well hydrated. And that means primarily with water. And if water is not your thing, you can always put a squeeze of lemon or lime into your water, or even make spa water with slices of oranges or cucumbers or something like that to improve the taste. But it's going to be important for you to stay well hydrated through the journey. Regarding physical activity, if you're already doing some physical activity and you're comfortable with that, you ask your healthcare provider, but you should be able to continue that as long as you feel up to it. If you're not doing any physical activity at the time, you do want to have daily movement if you feel up to it. It all depends on your specific situation.
Thank you for joining us. To end our first episode, we asked Jonny Imerman and Jonny Imerman to answer this question. What is the one thing you'd like to say to a newly diagnosed AYA patient?
Rely on your medical team. Let them help you, guide you. Don't be afraid to be vulnerable with them. We are here to help you in every way, shape, or form so you can be successful throughout this journey. Rely on your friends and family, your community, spirituality. Know that there is light at that end of the tunnel. As difficult as it is, we as your support system will help you get through this.
Anyone recently diagnosed, I think the best advice is you got to keep a couple things in your life going. You have to have a purpose outside of cancer to get up in the morning, whether it's going to a job, whether it's building something new, even if you're just volunteering, that's great too. Something. Maybe you're not going to work 100%, and you're probably not. But if you work 50%, you still have a purpose to get up in the morning. It distracts your mind. And I would also say, obviously, find the right doctors and the right hospitals. That's key too. You can't just go to the first person and think this is the best doc for me, because it may not be.
And that concludes our time for today. Thank you for listening. As a reminder, we'll post the 5 Stop a Doc questions you should ask your doctor below so you can bring them into your next appointment. In the next episode, we discuss all the medical terms and types of doctors involved in treating AYA patients and how to keep your health information organized. Tune in to Diagnosis, Who's Who and What's What in AYA Cancer for more information. And remember, we're here to help. See you next time. This has been Come On In, AYA Cancer Unfiltered, a podcast for patients 15 to 39. This podcast was produced by Reimagine Well with funding by 70K. Our creative producer is Emma Grace Eisenman with video production by Sedona Cruz. Our creative director is Roger Holzberg. Our content supervisor is Adele Sender. Our project manager and coordinator is Pamela Primessa Karstens. Our social media manager is Sedona Cruz. Our social media intern is Ryan Meglino. Script by Emma Grace Eisenman, based on the Adolescents and Young Adult Cancer and Oncofertility Guides by Reimagine Well. Audio editing by Emma Grace Eisenman. Video editing by Sedona Cruz. Additional audio and video editing by Graham Karstens. Digital artwork by Ray Jameson. Graphic design by Sarah Gray. A big thank you to our medical experts, Dr. Leonard Sender, Dr. Lakshmi Kondapalli, Jocelyn Harrison, RDN, Ginny Urikel, MSW, and Debbie Wagers, CCLS. Our guests for this episode were Jonny Imerman of Closed Talk and founder of Imerman Angels, Mallory Casperson, MS, co-founder and CEO of Cactus Cancer Society, Lauren Creel, MSW, MPH Chief Operations Officer of Cactus Cancer Society, David Craig, CEO of Grit Health, and Lauren Lustauskas, Vice President of Community at Grit Health. Stephen Giolarakis, President of the Stephen G. Cancer Foundation, Angela Giolarakis, PhD, founder of the Stephen G. Cancer Foundation, and Blake Dirksen. Thank you. This podcast is possible because of you. I've been your host, Marie Sad, and thank you for listening.